I am a registered dietitian by trade. So before coming into the food insecurity world, I worked in different clinical settings. So I get to take that knowledge and help our neighbors make healthy choices at our pantries. All right, so just what you can expect from this presentation. I am going to be diving into a little bit into the program that I implement at Phil Abundance that's called the Healthy Pantry Initiative. So we'll touch on that a little bit, and then we're going to switch gears and talk about the importance of nutrition at our food pantry distributions. And then lastly, we will talk about the ideal distribution model of a food pantry, which is a full choice model. We're going to talk a little bit about that and why it's the preferred method. So what is the Healthy Pantry Initiative? The Healthy Pantry Initiative, it is a project of Feeding Pennsylvania in partnership with the Pennsylvania Department of Health. So I'm sure you've heard of Feeding America. Feeding Pennsylvania is just a subset of that. So the Healthy Pantry Initiative, it is a grant-funded program through the Department of Health. So that grant is what allowed Phil Abundance to hire me and come out and do this work. There are nutrition educators all across the state who are also doing the same program as me. So I know we have representatives from the Central PA Food Bank here. They also have the Healthy Pantry Initiative there. I have colleagues in Pittsburgh, in Erie, in Allentown. It's really cool to see how we all implement this work at our respective food banks. The whole point of the Healthy Pantry Initiative, right, is to not only help our sites like you all procure and distribute the healthy food that guests need and deserve to have a high quality of life, but then also increasing the consumption of these foods. The amount of times I've heard somebody say, Katie, we have been receiving sweet potatoes week after week for months now. People are tired of seeing it. They don't want to take it anymore. What can we do? Or I remember I went to a site up in Jenkintown, and they had the largest rutabaga I have ever seen. And they're like, nobody wants to take this. What can we do? And that's where I come in and provide resources and recipes to help our guests feel empowered to use the great food that they're receiving. The long-term goal of the Healthy Pantry Initiative is to increase the quality of life while reducing the burden of disease for our neighbors who use food support systems. So for the Healthy Pantry Initiative, there are 5 strategies that we focus on. 1, increasing healthy inventory, of course. 2, implementing nudges or environmental strategies, which I will get more into in a little bit. Number 3, promoting and marketing health and nutrition to our neighbors when they come out to the pantry to receive their food. 4, nutrition policies and guidelines at the food pantry level. So, when you're thinking about procuring food, are we thinking, we're trying to prioritize getting healthier items? I know in today's world where the supply chain has, been an issue and the SNAP allotment ending, we don't have an abundance of food as we did before. So people are like, we're just trying to feed our neighbors at this point. But, keeping nutrition at the heart of it. And then number 5, promoting additional resources and services to clients and staff. So that can be offering referrals to a diabetes prevention program in the community, or hosting somebody to come out to distribution to help your neighbors sign up for SNAP benefits, things like that. All right, so why is it important? I'm sure all of us here have a good knowledge of this information, but just to reiterate it, we know that poor nutrition is one of the key lifestyle risks for developing chronic diseases. And this can include things like obesity, type 2 diabetes, heart disease, chronic kidney disease, strokes, Alzheimer's disease. We know that nutrition plays a role in the development of these diseases. So 6 in 10 adults in the U.S. have a chronic disease, and 4 in 10 have 2 or more chronic diseases or comorbidities. That's a little shocking, isn't it? In our state of the world, we see that adults are more likely than not to have at least one chronic disease. All right, so I apologize for how wordy this slide is, but I, being the science nerd that I am, I love statistics, and just hearing what's going on in the community. So almost 10 years ago now, there was a Hunger in America study done where they surveyed adults who were living in food insecure households. And they found that those adults are, one, consuming fewer servings of fruits and vegetables daily, as well as dairy. And this can lead to the development of those chronic diseases that I had just mentioned, right? Hypertension, obesity, diabetes. Lower income individuals often will purchase inexpensive, calorie-dense food to stretch their dollar, but it might not be nutrient-dense. So if you're thinking, I use the analogy, you could go to the drive-thru and pick up a meal for a family of 4 for cheaper than going to the grocery store to pick up the ingredients. But then somebody challenged me and said McDonald's raised their prices. So take that as you will, but it's often easier for somebody to go pick up something that is calorie-dense. And then of all the households surveyed, almost 60% had at least one member living with high blood pressure, and a third of all households report a member with diabetes. So think about these numbers at your distribution and the amount of guests that you're seeing. Now, you're bound to come across people who themselves or they know somebody who is living with a chronic disease that is related to diet. And then to take that a step further, with our older adults, almost 80% report a member with high blood pressure, and almost 50% report a member with diabetes. So we really want to focus on these populations that are more at risk. Food insecurity and competing needs. We know that our guests will often have to make these difficult choices, whether they spend their money on paying rent or spending their money on food. One that I always highlight when I give this presentation is this middle point. 66% had to choose between food and medical care. So I have a sibling who has type 1 diabetes and is insulin dependent. So if he didn't take his insulin, he wouldn't live, right? So now think about somebody who doesn't have a lot of funds or their insurance doesn't really cover insulin. So having to make that choice, do I eat? Do I take my medication? Do I eat? Do I go get that screening done? Check my blood pressure. Nobody should have to make that choice, right? So we want to set up our neighbors for success in providing them with the healthy food that they need and deserve at the food distribution setting. Another reason why it's important is consistent pantry usage. So earlier I asked who had been at the organization for 3 years or longer. Even if you've only been at your organization for a short amount of time, I'm sure you've started to see some familiar faces come back week after week or month after month. I know for the sites that I've been working with through the Healthy Pantry Initiative, I get to know the neighbors too. They come in and they're like, "Oh, Katie's here. What do you have to sample today?" We get to know each other, build that rapport. So we utilize that, relationship building to target them for nutrition education and health education. If we see them once, you could give them education, but it might not stick. But if we give it, time after time, it's more likely to stick in their heads. Client preferences. So I'm sure you're asking me why. This is pretty self-explanatory, right? The most requested items by our guests who are coming out to food distribution are fresh fruits and veggies, dairy and eggs, and poultry and meat. I'm sure I see some heads nodding, and you're like, yeah, that makes sense. That's what people are coming out to look for. The least requested items by our food pantry guests are the sweet and salty snacks and sugar-sweetened beverages. So that's not to say that, if it's available, that people aren't going to take it. If there's a box of cookies, like, oh, that looks great. Yeah, I enjoy a treat. We're not the food police. We're not here to judge people. I know for our partners who participate in our Grocers Against Hunger or Retail Rescue program, you often get donated baked goods. There's a time and place for everything. It could be somebody's birthday, and they weren't going to have a dessert to celebrate, but they are able to get it at distribution. But all that being said, guests aren't going to a food distribution to say, I just really need that pack of Coke. I'm going to go see if the food pantry has it. That's not why people are going. They're trying to get these nutrient-dense food items. All right. Putting it all together, food insecure individuals are at a higher risk for chronic disease. Nutrition plays a key role in both preventing and treating chronic disease. Due to competing needs, pantry guests will often go out and purchase the inexpensive, unhealthy, calorie-dense items to stretch their budget. And pantry clients use our services regularly, creating an opportunity to make a difference in the food intake and health of our clients. All right. So it's a little blurry. I apologize about that. Who here, raise your hand if you do the ordering through Philabundance on Agency Express for your organization. Awesome. All right. So think about last time you were on Agency Express and you were looking at food and it said low sodium black beans dash HNV or MNV or LNV. Has anybody noticed there's a 3-letter acronym at the end of the item line? So that's directly related to the Healthy Eating Research Nutrition Guidelines for ranking charitable food that came out of Feeding America. So Philabundance has adapted this program. We are consciously trying to procure foods that fall into the high or medium nutritional value ranking. I often compare this to the stoplight system. Green means go, means good, means high nutritional value. Yellow, medium nutritional value, and red is low nutritional value. They are based off of 3 nutrient levels that are more likely associated with the development of those chronic diseases I was mentioning. Saturated fat, sodium, and added sugar. So next time you're in Agency Express, take a look at that 3-letter acronym. You can help that guide your ordering. Say, okay, I would like to provide healthy items to our guests. How can I do that? That's just one way that we're able to assist with that. All right. And lastly, the Healthy Pantry Initiative. Although I recruit cohorts to participate, I'm up to 40 partners now participating in the program. But it's available for, the resources are available for anyone and everyone to use. So I have the link up here, feedingpa.org/PA Healthy Pantry Initiative. You can go on there. We have a complete library of recipes that have been created by chefs specifically for this program. So they come to us, nutrition educators, and they say, hey, what items are you seeing at the food pantry? What cooking utensils do you find that your guests have? What are their needs? So the recipes are often one pot, microwavable. We have a whole kid-friendly recipe series. So, if an adult isn't around to assist in cooking, it's something that's safe and easy for kids to make. I brought a few examples. They are on this bar that has Bud Light. Feel free at the end of the presentation to come take a look and take any handouts that you'd like. But those are available online. We also have a bunch of our other print resources under the tab that says Resources for Pantries. We have produce cards. We have how-to cards, so how to cut a mango, how to cut a winter squash, how to break down a whole chicken. Just break these barriers down that our guests often face. All right, so now we're going to segue a little bit into the choice pantry model of distribution. Who in here has heard of this term before? Choice pantry or full choice? All right, so we got a few. All right, so the choice pantry model closely resembles a grocery store. Clients have the opportunities to either walk through the space themselves and with the help of a volunteer or a shopper, make the selections that they would like for themselves. This provides a very dignified experience for clients. It takes away the stigma that you often hear of at a food distribution where you see people lined up and everyone's there to just take a box and go on their way. This makes it more personal, more dignified. This also provides the opportunity to nudge clients to make healthy choices. The client choice model promotes a higher satisfaction with the food that they are able to choose. It results in less food waste because people are receiving the food that they want. There have been times where I've been at a food distribution and everybody receives the same thing, and then you walk out the door and people are leaving the food that they don't want on the sidewalk or at the bus stop We're not in a business to waste food. We're here to feed people. So giving people the choice ultimately leads to less food waste. And it's a great opportunity for our volunteers and our pantry guests to interact. Just taking a minute to chat about, what's your favorite recipe to make with this ground beef, or anything. Just breaking those barriers and getting to know the people you serve really goes a long way. So I've been saying this word nudge, that we want to nudge our clients to make healthy choices for themselves. So what is a nudge? According to Feeding America, a nudge is a subtle environment change in a food distribution setting designed to make the healthy choice the easy choice. So think about the last time you went to a supermarket. I'll share from my experience. When I walk into the grocery store by my place, the first thing you see is the produce, and it looks amazing. They have it stacked all nicely. It looks like there's an abundance of food. It's clean. All of the items that have blemishes have been removed. So we're getting into summer. The grocery stores will put out displays, with like the summer fruits and vegetables that are in season. They might put together ingredients, to make guacamole, or they might have corn on the cob and tomato and lettuce just to, encourage you to pick these items. Or the example I like to use is think, to September, October when it's pumpkin season. And you can get just about anything pumpkin now. And the grocery stores, they want you to know that. So they will have big, flashy displays. You can't miss it. And they'll place them, throughout the store. So you might pass it in this aisle, and then a few aisles later, you might see it again. They do that on purpose, to get you to notice it and get you to want to choose these items. So we take this same approach and apply it to the food distribution setting. I love pictures. I feel like pictures speak 1,000 words. So I have some pictures here for you to show some examples. The pictures on the left and in the middle, those are from Fawn's location at Frankfurt High School. So you can see the first picture on the left, they have their healthy items in the first section clients see. So they walk in and they immediately see this large selection of produce. They'll be encouraged to take these items first. The middle picture, we have the healthy items placed at eye level, so they're easy for guests to identify. It's the first thing they see. They don't have to search the shelf for low sodium option or fruit canned in juice, things like that. I apologize, it's hard to see, but we have a couple of our shelf talkers installed on this shelf as well. They say things like healthy option, or good source of protein, or this food contains fiber. Fiber is good for your heart health and managing blood sugar. Even all the way down to this food contains important vitamins and minerals, just to guide guests in making their choices. And then the picture all the way on the right, abundance. If it appears like you have an abundance of that item, whether it's true or not, we know that encourages guests to make that choice. There could be 3 bell peppers left, and somebody could be walking through and say, I don't know if I need it. I'm going to leave it for somebody else who's coming after me. They need it more than me. We want people to feel empowered to take these things for themselves. So some other nudge examples of before and after. So if you're looking at the top left, you can see the volunteers put the shipping boxes that the produce came in on the table. It definitely looks organized, and I'm sure it was very easy for them to set up and break down at the beginning and end of distribution. But we could take it a step further and make it look a little more dignified, right? So through the Healthy Pantry Initiatives grant, we were able to purchase these wooden bushel baskets. Just makes the appearance of the space look warmer and nicer. So we encourage the volunteers to take all the items out of the boxes, put them in these baskets, and just appears nicer, right? And then the picture in the top right, your first thought, you're like, what's wrong with that? They took everything out of the boxes. It looks like there's an abundance. It looks great. But if you look closely, the baked goods are on the same table as the produce. Sends a little bit of a mixed message, right? We're trying to encourage people to pick the produce, and then they get to the baked goods, and they might take more than we would like them to. So we'd prefer that the baked goods be put maybe towards the end of distribution or in another part of the pantry to really let that produce shine. So we purchased these black wire shelving units through the HPI grant. Really made it feel like a grocery store. They have all their produce organized so nicely. It just really gives guests that dignified experience. So some other nudge examples, I mentioned the signage such as shelf talkers and posters. So if you look closely, these say low sodium, diabetes friendly, and good source of protein. The middle picture is a packaging nudge. So who here has heard of a meal bundle or a meal kit? Does that sound familiar to anyone? All right, see a few nods. So think about the concept of HelloFresh or Blue Apron, right? Where they give you the recipe, they give you all the ingredients you need, and they give you the instructions, and you go and you cook. We kind of adopt that same concept where we pair it with a recipe, one of our HPI recipes. We pair that with the ingredients that are available at the pantry that day to encourage guests, to try scratch cooking if they are able to. And then the picture all the way on the right says nutrition labeling and value labeling. So that could, we have our produce cards on that table, which share a little bit of information about different produce items that are available. Just provide that little bit of education there. All right. So since we're all in this lovely space, I would love to have the opportunity to walk everybody through, a full choice model of distribution so you could really experience what it's like for our guests. So we worked with our partners over at Babashi in Spring Garden, and they graciously allowed myself and my partner John to go in and film what it's like for the guests to shop in a full choice model of distribution.
Hi everyone, today we are going to walk through Babashi's Food First Pantry through the eyes of the pantry guest. Babashi's Pantry operates as a full choice model of distribution. This allows guests to participate in choosing for themselves which items they take home. This concept is like a grocery store, with a full array of available goods displayed, and guests pick the items that they want and need.
Good morning.
Good morning. How are you?
Welcome
Happy
to Babashi's
Thursday.
Pantry. Yes, thank you.
you.
Yes. Would you like to sign in?
Yeah.
First time you've been here?
Yes, first time.
Great. Welcome.
After the check-in process is complete, the neighbor grabs a cart and gets to shopping. And notice how Babashi has signs on their shelves with different point values for each item. Guests are given a lump sum of points based on household size, and guests can shop based on the number of points they receive. The first items guests can shop for are produce, dairy products, eggs, and proteins. Babashi has these items at the beginning of distribution to highlight their nutrition value and to get guests to notice them first. This is to encourage guests to make healthy choices right off the bat. Guests are also able to choose from a variety of lean protein sources such as chicken, ground turkey, and ground beef. Once we pass the fridges and freezers, guests are able to shop the shelves just like you would at a traditional grocery store. Thanks to Babashi's partnership with Phil Abundance and the Healthy Pantry Initiative, guests are able to shop for a wide variety of healthy food options to establish healthy eating habits for the whole family. Notice the colorful signs on the shelf? These are shelf talkers designed to nudge guests to make healthy choices. Babashi and Phil Abundance have had a great partnership over the past few years and have been participating in the Healthy Pantry Initiative since spring of 2020. Healthy items are available at every turn in the Babashi Food Pantry. In addition to breakfast cereals and other pantry staples, guests can find healthy snacks such as nuts, trail mix, protein bars, raisins, and other dried fruit that make snack time healthy. Guests really enjoy this section of the pantry. Babashi also carries other food items such as condiments, herbs, spices, and even household goods. Along with providing guests protein, produce, dairy, and eggs, guests are also able to choose bread donated from grocery stores in the area. Thanks for shopping with us at Babashi's Food First Pantry. Guests have a dignified experience while they shop for themselves and their families, making food choices that best meet their unique needs.
All right, so I hope you all enjoyed walking through food distribution over at Babashi. Hopefully you got a few ideas, that you can take home with you. Big shout out to Babashi for allowing us in your space. All right, so what if you're thinking to yourself, all right, we don't have the capacity right now to switch our operation to a full choice model of distribution, but we want to make a change. So what can we do at this point? So there is something that's called partial choice, where guests are still able to make some choices for themselves, but maybe not all the choices. So that can include a shopping list model, where guests are given a list of all the items or different food groups that are available at distribution that day and can go through and make the selections that they would like. Then the paper gets back to volunteers, they pack up the bags and boxes, and then the guests are on their way. You could have a client choice with modifications, such as appointments only, or allowing one person in at a time, or having a personal shopper with the guest as they go through the space. You could even have different pre-packed boxes if that's what your capacity allows for at this time. So maybe you have something that's lower in added sugar, or gluten-free, or vegetarian, or vegan. Having it so we can at least cater these boxes a little bit to our neighbors. Something that I always recommend is for somebody who's trying to start the transition to being a choice model. Start with just one or two food groups. Start with just the grain products, or start with just the fruit and vegetables. Start small. These changes don't need to happen overnight. And I'm going to ask my colleagues to hand out a flyer that we made about full choice distribution. We surveyed a bunch of our partners who already operate in this model of distribution and got their feedback. What were some of the barriers you faced? How did you overcome those barriers? What did you do when you got pushback from your volunteers? What did you do when you had a small space? How did you make that work? So we have provided all of that on this handout that is currently going around. So a couple more examples of nudges with partial choice. You could add resource displays where clients check in to pick up food. So you can see the picture on the right. This pantry chose to display a bunch of different recipes and produce information just right on this table. So while guests are waiting to check in or waiting for their turn to shop, they're able to look at these materials, add materials to boxes. So add in a recipe card, a seasonal recipe card, to each box during distribution. Just get the word out, get people familiar with these items. And then back to the meal bundle or meal kit, utilize this concept, have it pre-packed or just have it as a display to give guests the idea. All right. So lastly, before we get into some time for question and answers, I would love to invite Miss Desiree up to the stage. She is just going to share a couple words, about what being a full choice model of distribution means to her and the neighbors that she serves. So give it up for Miss Desiree.
Good morning, friends. So as you know, it's not always dignified when you go to a food pantry. Years ago, I received food from a food pantry, which is how I started food pantries. And it was after a fire, and they bought me a box. And the box had old, rotten produce. And it had wax beans, kidney beans, and another bean, chickpeas. Do I look like I eat any of that? And I had 3 children at the time. So I was so disappointed because I waited all day long after a fire to get food from a food pantry, and that's what they gave me. It all went in the trash. And when we give people boxes, we have to think if that's what you can do, just make sure that your selections that you put in there are items that people can actually eat. But having a choice model, whether it's full choice or partial choice, it gives people a voice to say what they want to eat. When you go into the supermarket, no one just gives you a bag of groceries and says, be on your way. You get to go through and pick what you want. So for our friends at Murphy's and Ujima and Grace Tabernacle and even Resurrection, when I started food pantries, I made sure that it was set up that people can pick what they want. It is challenging finding volunteers to service each area. And the biggest challenge is that people sometimes want to take more than their share, right? But that's because of fear of not having enough. But people can then, if they have the choice, they can pick up the can and read how much sodium, read if it's gluten-free or not, read all the things that pertain to their health and their culture. So at Murphy's, it's in Upper Darby. We call it Little New York, so we have over 90 different languages and dialects spoken in Upper Darby. And by having a choice model, people can shop and get the food that they want for their families that's relevant to their culture. Because if we're packing a box, we put macaroni and cheese and spaghetti and mashed potatoes and string beans in a box for a Bangladeshi family, it's a waste. They don't want that. Even last year when we did the Let's Eat was awesome. People got to experience food from different cultures. But the challenge was, Let's Eat boxes had chicken broth in them. So what did our Islamic population do? They went through the boxes and took out the chicken broth. Luckily, we had vegetable broth on the shelves at our food pantry, and we were able to substitute. So people need to be able to choose what they want for themselves. That lets them maintain their dignity and respect, and then we are really their neighbors. We have come on the same level as them. They don't see us as someone just handing them a box. They don't see us as big us and little them. So if you can, if you're able to even offer partial choice, it opens up and builds relationships because it means you care. That's it.
So I want to thank you all so much for your time today. It's been a pleasure, and I hope you enjoy the rest of your day.